Good afternoon, Dr. Brick. My name is Patience Bello. I'm here to do my head-to-toe assessment. Here is my space. This is the clear of my space. Here is my patient. And there's my videogram. I've cleaned my stethoscope. I've cleaned my pen light. I've done my hand hygiene, and if I have gloves, I will be wearing one. Now I'm meeting my patient. Good afternoon. My name is Patience Bello. I'm a student nurse. Can you tell me your full name and date of birth, please?
My name is Samuel Mina, April 27, 1995.
Good. I'm here to do an head-to-toe assessment with you. Is that okay?
It's okay.
Consent taken. You want to use the washroom?
No.
Comfort provided and privacy provided. Moving on to general survey. Can you tell me your age?
I'm 28.
Patient's sexual development appear as stated age. Patient's skin color is dark and even. Moving on to body structure. Patient is in a sitting position. Patients appear well nourished. No physical deformity seen. Moving on to behavior. Patient is able to maintain good eye contact. Patient's speech is clear. Patients dress appropriately to suit the occasion, and patients appear hygienic. Moving on to mobility. Can you take a walk up for me and back? Patient gait is steady and balanced, with hands swinging bilaterally and simultaneously. Walk of breath. There's no distress breath seen, and there's no labor breath seen. Moving on to neurological and eyes. Level of consciousness. Can you tell me your name?
My name is Samuel.
What day of the week is it?
Today is Monday.
What date?
27.
Where are you?
I'm at the library.
Patient is alert to place. Patient is alert and oriented to place. Safe. Date. Oriented ×3. Now moving on to facial names 7, which is facial names. Planar name 7, which is facial names. Can you pop your cheek? Grimace. Smile. Frown. Raise your eyebrow. Close your eyes while I try to open it. Patient's motor function is symmetrical. Therefore, planar name 7, which is facial names, is intact. Moving on to planar name 3, which is oculomotor names. Here I will be using the acronym POPLA to assess my patient's pupil. Starting with the pupil size. Patient pupil size is 3 mm, equal and round bilaterally. Now we'll be doing the reflection of light. Patient's left eye constricts on direct light reflex, while the right eye constricts on concentric light reflex. Patient's right eye constricts on direct light reflex, while the right eye constricts on direct light reflex, while the left eye constricts on concentric light reflex. Now moving on to accommodation, which is it. Can I have you look at the tip of my pen when I move it close to you? Patient has a normal pupillary constriction and convergence of the axis of the eye. Therefore, planar name 3, which is oculomotor nerves, is intact. Moving on to planar name 8, which is acoustic nerves. Here I will be planar name 8, which is acoustic nerves. Here I will be doing the whispering test. Can I have you use your hand to push down your triggers of your ear and whisper to your ear?
White, green, red. White, green, red.
Patient was able to hear whisper words at a distance of 30 centimeters. Therefore, cranial nerve 8, which is acoustic nerves, is intact. Looking at the nose is at the midline, there's no discharge, there's no fairing. Now moving on to cranial nerve 9 and 10, which is grossophagus and vagus nerves. Here I want you to tilt your head back while you say ha.
Ah.
Patient soft palate and uvula rises when patients say ah. Therefore, cranial nerve 9 and 10, which is grossophagus and vagus nerves, is intact. Now moving on to skin. Can you move your hand for me? I'll be assessing the MSK, which is the musculoskeletal. Upon inspection, there is no scarring, there is no lesion, no physical deformity, and there is no moisture. Now palpation. Any pain or tenderness?
No.
Patients report no pain or tenderness, no masses, no excessive moisture, and body temperature is warm bilaterally. Now moving on to capillary refill. Capillary refill is plunged bilaterally and less than 2 seconds, which indicates good blood circulation. Can I do your radial pulse, please? I'll be counting for 30 seconds times 2. Radial pulse is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Can I take your brachial pulse? The brachial pulse is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Now, moving on to range of motion. Can I have you flex your knees for me, please? Flexion, extension, radial deviation, ulnar deviation. Any pain or tenderness? No pain or tenderness. Now, moving on to the elbow. Bring your elbow to yourself. Flexion, extension. Any pain or tenderness?
No.
Supination, pronation. Any pain or tenderness?
No.
No pain or tenderness. Moving on to the shoulder. Abduction, abduction, internal rotation, external rotation. Any pain or tenderness?
No.
No pain or tenderness. Can you grip my hand? Any pain or tenderness? No pain or tenderness. Patients report no pain or tenderness, no crepitation sound heard. Patient has a great strength of 5 plus, therefore patient has a full range of motion. Moving on to the legs. Patient's legs, the hair is evenly distributed, there's no scarring, no lesion, no physical deformity seen, no motion. On palpation, there is no motion, there is no masses. Any pain or tenderness?
No.
No pain or tenderness. No pain or tenderness. And body temperature is warm bilaterally. Now moving on to capillary refill. Capillary refill is plunged bilaterally, less than 2 seconds, and which indicates good blood circulation. Going on to posterior tibial pulse. Posterior tibial pulse is counting for 30 seconds times 2 is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Moving on to dorsalis pendis pulse. Counting for 30 seconds times 2. Rate is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Now moving on to the range of motion. Can you stand up for me, please? Touch your toe. Flexion, extension, left lateral bend, right lateral bend, left lateral rotation, right lateral rotation. Any pain or tenderness?
No.
No pain or tenderness. Lie, sit down. Can you take your left leg forward? Flexion. No, extension. Again. Extension. Flexion. Extension. Flexion. Any pain or tenderness?
No.
No pain or tenderness. Can you move your toe towards your face, against the forces of my hand, towards your nose? Any pain or tenderness?
No.
Dorsal flexion. Move it down against the forces of my hand. Plantar flexion. Any pain or tenderness?
No.
No pain or tenderness. Upon assessment of the patient's range of motion, patients report no pain or tenderness, no crepitation sound heard. Patient has a great strength of 5+, therefore patient has a full range of motion. Now I'm doing my hand hygiene. Can you stand up for me, please? And are you able to take off your shirt? Thank you. So here I'll be assessing the posterior thorax cavity. Upon the assessment of the posterior thorax cavity, there's no scarring, no lesion. The spinal process is on the midline. The scapula is symmetrical and there is no deformity. Now I'll be doing the chest expansion at the T10. Take a deep breath in, please. My tongue move apart when the patient took a deep breath in, which indicates symmetrical chest expansion. Now I'll be doing the posterior arterial transverse diameter. Posterior arterial transverse. So patient has a 2:1 posterior arterial transverse diameter, which indicates normal findings. Upon palpation, any pain?
No.
Any tenderness?
No.
No masses. Body temperature is warm bilaterally and is warm bilaterally. Now, moving on to this, I'm going to be listening to the breath sound at the 9th point. Listening to the breath sound at the 9th point. Can you take a deep breath in where I listen to the breath sound, when you feel the touch of my stethoscope? 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, 9. So I listened to the breath sound for 1 minute. There was it was 12 beats. The respiration was 12 beats per minute, and the reading was regular. There was no adventitious sound heard, no crackles, and no wheezing. The bronchoscopal sound was heard at T2, T3, and T4, while the rest of the lungs I heard the vascular sound. The trachea and the lungs and the larynx I heard the broncho sound. Now moving on to the cardiovascular. Can I have you come up here to lay for me, please? Sorry. Move that way. Sorry. Here, upon assessment, I will be assessing the cardiovascular. I'll be draping my patient. Be listening to the valves starting from the right second intercostal space, which is the aortic. At the second intercostal space, by the midline of the right stellum, is the aortic. Moving on to the left side at the second intercostal space by the midline of the left sternum is the pulmonic. At the third intercostal space by the midline of the left sternum is the air point. At the fifth intercostal space by the midline of the left sternum is the transcopid. Moving on at the fifth intercostal, moving on to the fifth intercostal by the mid-clavicular line is the mitral. Here I will be listening to the apical pulse for 1 minute. The apical pulse was 60 beats per minute and the rhythm is regular. The S1 sound was heard best at the mitral, which is the apex of the heart, while the S2 sound was heard at the base of the heart, which is aortic and the pulmonic. Now, aortic or the pulmonic, I'll be listening to the extra sound and murmur sound using the bell. So I'll be listening to the 5 verb again. The aortic, the pulmonic, air points, transcopid, and the mitral. There was no extra sound or murmur sound heard at the S3 and S4. Now moving on to the abdomen. Upon inspection of the abdomen, the hair is evenly distributed in diamond shape. The umbilical is at the midline. There is no pulsation, no peristalsis. Cutter is round and symmetrical. Now moving on to occultation. Starting with the right lower quadrant. I'll be listening for 1 minute. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sound was heard at high pitched, gurgling and cascading 5 to 30 times per minute, which indicate normal findings. Now I will be palpating. Starting with the right lower quadrant. Any pain or tenderness?
No.
No rigidity? Any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Upon palpation, patients report no pain, no tenderness, no rigidity, no girdling, and there was no superficial masses felt. So before I round up, I'll be palpating the bladder just above the syphilis bone. Any pain or tenderness?
No.
Upon assessment of the bladder, patients report no pain or tenderness. Thank you.